So right now, I would like to welcome Dr. Rita Gandhi. And if you want to give a brief introduction, that would be amazing. And then we'll see your slides.
I'd love to. I'd love to. Thank you guys so much for having us here. We're really excited to be able to present. Just briefly, I'm a movement disorder neurologist and trained at Georgetown and worked at Marshall University for a number of years. So helped to develop their movement disorder program and see Huntington's patients in Huntington, West Virginia. So I'm just super excited to be with you guys today, just briefly. So is it okay if I start presenting my slides or bring it?
Absolutely.
Perfect. Okay, great.
And please take your full time.
Yes.
We want to see this
no worries.
presentation. Yes.
Absolutely. No, absolutely. I have to, full disclosure, I am technologically not very savvy, so I may be clunky, but I will do my best to get this in. Okay, I think I can get this. I think we have it. Okay, I think this is it here. All right, and you let me know if you can see it or not. I'm assuming you can see it. I think so. Okay,
Yeah.
perfect, great. So again, I'm just really thrilled and humbled to be with you today to share just some important updates pertaining to the tominersen program. And as I mentioned, I'm Rita Gandhi. I'm a movement disorder neurologist. I've taken care of Parkinson's patients and Huntington's disease patients, and I've been with Genentech now for about 5 years. And so the information I'm going to be presenting is really for the community, and I want to be able to acknowledge with gratitude all the people who have and who will continue to enroll in our study program, because it is really important, not only just to us, but to all within pharma in general. We really rely on you, and so we are so thankful for the families and the patients who do contribute. Just as a quick disclaimer, as again I mentioned, I am a Genentech Roche employee, and tominersen is not an FDA-approved medication, and so none of the information here provided should be construed to be as a recommendation for its use. I do want to say that Genentech is part of the Roche group, and our mission is to pursue groundbreaking science in order to discover and develop medicines for people with serious and life-threatening diseases. And for decades, we've been conducting neuroscience research and clinical trials aimed at exploring areas of the highest medical need. And this is all done by partnering. So we partner widely across several areas: advocacy, academia, industry, and a broader healthcare community. Our goal is to continue to push boundaries of scientific understanding and to achieve clinical advancements for patients. So today I'm just going to be talking in about 3 main areas. So one, I'd like to go over the history of the tominersen program. I'd also like to discuss our recently open Generation HD2 study design and the status. And then I'd also like to give just an update information on our clinical sites and our study. Just as a quick reminder, tominersen is what we call an investigational molecule. It's an antisense oligonucleotide, and it's designed to target the underlying genetic cause of HD, and it's directly delivered to the central nervous system via what we call an intrathecal injection called a lumbar puncture. So we've had a long experimental history and strong commitment in Huntington's disease going back about a decade. So this began as a partnership with Ionis in 2013 as tominersen was first developed, and it led to a phase 1/2 study in 2015 to 2017, which then led to the Generation HD1 phase 3 trial. And as many of Generation HD1 unfortunately did not meet its main objective. And in 2021, dosing of tominersen was stopped after the overall benefits and risks were evaluated. And since that time, exploratory analysis available to Roche suggests that a lower exposure to tominersen may benefit a younger adult patients with earlier stages of Huntington's disease. Therefore, the new Generation HD2 phase 2 study aims to assess lower doses of tominersen in an earlier HD population. So I'd like to talk a little bit about how Generation HD1 is different from Generation HD2, because it is a different study. So the biggest differences we see is that in Generation HD1, this was a little bit of a later population. These were patients that were 25 to 65 years old, and they had what we call a CAP score, which I'll talk a little bit about, that was greater than 400. But in Generation HD2, we're really looking at a prodromal or sort of an earlier population, earlier manifest HD. And these individuals we're looking at are between the ages of 25 and 50 years old with what we call a CAP score between 400 and 500. In addition, are the number of the trial participants. As you remember, Generation HD1 was a fairly big trial with 791 subjects. And currently in Generation HD2, we're looking at approximately 360 patients total. The study length for each participant in Generation HD1 was a bit longer. It was 25 months. But in Generation HD2, it's 16 months with what we call common close design, which I'll also talk a little bit about. Lumbar punctures were done every 2 months in Generation HD1, but in Generation HD2, it is every 4 months with a potentially with an extra LP at month 9, where drug won't be given. And then in terms of the duration, we had 38 total assessments in Generation HD1 with 25 clinic visits, but in Generation HD2, we really expect a total of 30 assessments with only 8 in-person clinic visits. Now, when I talk about the CAP score is what we call a CAG age-related product, and it's a measure used by clinicians and scientists, which takes into account a person's age, their CAG repeat number, and it's a way to estimate a person's lifetime exposure to the harmful effects of the HD gene. With that, I'll go ahead and move to the next slide. So I'd like to go over the study design. So Generation HD2 is a placebo-controlled dose-finding study evaluating the safety, biomarker, and efficacy. And we'll be evaluating 2 doses. We're looking at the 60 milligram dose and 100 milligram dose every 16 weeks, again in the prodromal, that earlier prodromal and early manifest HD patient. The study will include a 4-week screening period, and participants will then randomly be chosen to be in one of 3 groups, either what we call the placebo group, where there's no drug, the 60 milligram group, or the 100 milligram group. And the study will be 16 months and has what's called a common close design, which means that the participants will remain in the study until the last participant's last visit. So there may be individuals that start at the beginning of the study or that get recruited earlier that may be in there longer because we're waiting for the last patient's last visit. But once the study is completed and we do review the data, there is a possibility of an open label extension where then all the participants will be able to receive the drug. So I'm pleased to say currently we have opened up the study in the US and Europe. And we have currently in the US, we plan to have 17 sites, and these are activated across all of the United States. And you can see here on the left, these are the sites that are currently enrolling. So it's in Boston. We have places in New York and Washington, DC, Baltimore, Chicago, Tennessee, Birmingham, Gainesville, Inglewood, and Spokane, Washington. And I would just say that if anyone is interested in participating in the study, please speak with your healthcare provider or National Patient Association just to see which sites are open in your area and also give more information about the criteria as well. So just in summary, Generation HD2 is a new dose finding study testing the 60 and the 100 milligram intrathecal injection every 4 months. Every participant will receive tominersen for at least 16 months and will continue until the last participant has completed the study. And a total of 360 participants with prodromal or early manifest aged 25 to 50 with a CAP score of 400 to 500 are eligible. And Generation HD2 is a global study expected to run in about 15 countries. Again, if you're interested, please speak to your HD specialist. And I just want to say, in the end, partnership is extremely important to Genentech and to Roche. And with this, we just wanted to give a big thank you to all the study participants and families, investigators, clinical sites, and entire HD community, really who make this research possible. Thank you. Just to escape here, I apologize.
Hi.
Hi.
So there was quite a few questions and we didn't approve that with you. So we could actually submit those questions to you if you would
Okay.
like. If you'd like us to ask you a couple and you just say, I can't answer this, that's fine too. It's 100% up to you. Whatever you feel comfortable with, we will absolutely do.
Sure. I know you guys are pressed on time. I'm happy to answer a few questions if you need me to.
Okay. Great. So one of them was about the 8-week, 2 years that they were in the 8 weeks. They were on the 8-week trial for 2 years. Both him and his sister were in the trial. They found great benefit being on Roche tominersen. But now with the trial stopping, they can't be in the second trial. Why is past participants just not allowed to? And he said, thank you very much for answering.
No, I'm actually really glad. And I as part of the presentation, that was something that I was wanted to proactively discuss, because we are aware, and then even just listening to the other question from Unicure too, we are aware that people were in the study, and unfortunately, those individuals that did get placebo, so if they were in Gen HD1 and they had placebo, they can be in Gen HD2. But as you mentioned, people who were in Gen HD1 who did receive study drug cannot be. And it's mainly it's in order for us to be able to interpret the data appropriately given the medications. So what we do know is that sometimes when you're on drug, whatever information or data that you can collect, that then becomes biased. So if people were on that drug and then they go into a new drug with new dosing, it's really hard to interpret that data because they were previously on the drug in the past. And if we really want to see if the drug is effective, if it is helpful, we need to have data that's with people who've never been on the drug before, so that we can truly assess if there's truly a signal or not. And that's generally where it's coming from. We understand that there are a lot of people who are on the medication that have had certain exposure and had benefit. And so our goal at some point is to be able to get that information and see if there's a signal, and then see how we can move forward with the population at hand, because we do totally understand that piece.
Yeah, and this is such a rare situation, right?
Yeah.
That this would happen. And so there's that two-sided of one, it is a clinical trial. It's about collecting data and finding out if this is going to be clinically beneficial. But when you are, and I don't have to tell you this, when you are fighting for your life every day and knowing HD is taking it away from you every minute, and you found something that you felt was beneficial, and then it's taken away,
Yeah.
that's hard. That's hard to have to go through. So to this individual, thank you for your participation in the first round. And I am sorry it's not available, but let's hope that your participation has pushed us forward to hopefully clinical benefit is shown in a subpopulation and we finally get the help that we deserve.